So, hello friends, and I am Dr. Abhijit Dam once again. So, today we will be discussing in this particular module, we will be discussing the various dimensions of cancer pain. So, what I mean to say is that we need to respect all other branches other than science, because you see visible light covers only 2% of the electromagnetic spectrum. That does not mean that 98% of the light is absent. It is there, just that we can't see it. Illness is a spiritual event. If you remember, whenever you were a little boy and you fell sick, you would go to your mother's lap or your grandmother's lap, and your mother would gently roll her fingers through your hair, and you would feel so good. Even the best of drugs can't afford that degree of relief to you. So, illness is a spiritual event. It grasps person by the soul and by the body and disturbs them both. It raises troubling questions of a transcendental nature about meaning, value and relationships. These are some of the things that science here really can't explain, but this is what we all go through. This is what most of the patients suffering from terminal pain go through. Now, what exactly do you mean by pain? Well, the International Association for Study of Pain has a brilliant definition, but for me, pain is what the patient says hurts. If the patient says that I have pain, period, that is it, that means he has pain. Now, the pain might not always be physical in nature. The pain can also be psychological, it can be social, it can be spiritual. There are so many dimensions of pain. Say you fail in an exam, or say you fail in a love affair, you still have pain, don't you? But can that pain be treated with a tablet of paracetamol or tramadol? You cannot treat that pain with paracetamol or tramadol, for example, but still it is a pain. That is a psychological pain, it is an existential pain. Now, here these pains also need to be acknowledged, and that is why in the previous slides I showed you the Varaha avatar. That is, you need to respect other branches. Science cannot explain everything. So, pain for me is what the patient says hurts, and especially if the patient is facing his last days of life, if the patient every day when he gets up in the morning and he understands that, oh, I just have a couple of months to live, and that is a horrible feeling which the patient can have. So, implications of definition of the pain, the International Association of Study of Pain, the definition of pain has various implications. The implications are that there is no specific organ of pain. So, if you say that the pain is only limited to my hand, or that only my particular one type of receptor is responsible for pain, then you would be wrong. Pain is not a sense like vision or sound. It is a conscious experience integrating the sensory, the affective, the cognitive and prior experiences with pain, and it is similar in response to an emotion, but it is experienced as a sensation. So, this is what makes it so brilliant. So, it is similar in response to an emotion, but experienced as a sensation because it hurts. Now, if you see this gentleman, he had severe pain. He had severe pain because you see, if you just focus on the left half of his face, he was a handsome man. But then when he got this devastating tumor in his right cheek, then because of the sight of the tumor, because of the smell which used to come out, he became a social outcast. Nobody wanted to talk to him. People avoided him, and then he lost his job. He was the only earning member of his family, and then his wife refused to sleep with him. His little daughter refused to come to him. His daughter started getting afraid of him. This gentleman had attempted suicide twice. So, for this gentleman, do you think that ordinary painkillers are going to take away his problems? Not at all, because his pain is quite complex. So, there are so many issues which are contributing to his pain. What is this? Yeah, this is an onion. So, you see onion, have you ever cut an onion? I am sure most of you would have done that, but when you cut an onion, you peel away the layers of the onion. You start peeling away the layers of the onion till you get to the onion per se within. So, similarly, if you reflect back on the photograph of the gentleman which I have just demonstrated, he had constant pain aggravated by chewing, that is the physical aspect of the pain, that is the nociceptive pain which we call. So, the first layer of the onion is coming off now. Now, go deeper inside, take out the second layer. He used to feel bad, he could not sleep, he could not eat, he used to feel irritable. So, that was the affective component of the pain. He could not work, he could not go out, he could not play with his children, nobody would visit him. That was the social aspect of the pain. He had attempted suicide twice, he used to be angry at others, he used to fight with his wife, and that was the behavioral aspect of the pain. And when you combine it all, so that what you get is total pain. If you cannot cut an onion properly, what you would get is tears. Tears of the patient, tears of the family members, because they cannot see their loved one suffering. So, this is the concept of total pain which was formulated by Dame Cicely Saunders. So, pain basically starts by certain pathways. Suppose I pinch you in your finger, those impulses are immediately transmitted by your nerve fibers up to the spinal cord, and from the spinal cord they are sent to the brain. So, there are certain particular type of nerve fibers which specifically transmit pain. So, they are the A, delta and C fibers. I will not go into the details of that. And once those pain fibers go via your spinal cord and they travel up to your brain, and there they form relays in the brain, and mostly the pain fibers are concentrated in two areas of the brain. One is the medial part, which is more or less central part of the brain, and one is the lateral part of the brain. Now, the central part of the brain is responsible for the emotions, your behavioral aspect, your affective part. What makes you cry, what makes you feel sad, what gives you compassion. So, those are in the medial aspect of the brain, and the lateral aspect of the brain is only responsible for localization of the pain. So, that will tell you where exactly is the pain, in your hand, in your feet. So, the lateral is only concerned with localizing. Now, there was an interesting experiment where they damaged the lateral part of the brain, that is the localizing part, but still in spite of damaging the localizing part, the lateral part, patients still could experience pain. But when they damaged the medial part without affecting the lateral part, the patients had no pain, which means that the affective, the cognitive aspect, the affective aspect, the psychological aspect, the compassion associated with all these responses, these things are more important in pain, and these are the things which we often neglect. Whenever there is pain, we immediately try to focus on drugs, drug therapy for pain. That is not the way it should be happening. So, a recent development has been the biopsychosocial interactive process of pain. So, there are certain biological aspects like your genetic makeup, right, your genetic predispositions, your processing, the way your brain is processing the pain, the way the nerve fibers are transmitting the pain impulses right up to your brain, and the way your previous experiences can cause conditioning. Like when I was a kid, my father used to take me to a dentist for dental extractions, and even today whenever I have to go to a dentist, I have the fear right from the beginning, because that is a conditioning, that is a conditioned response. So, these are certain biological factors, certain psychological factors, social factors, psychological factors like previous exposure to pain, or if you have just fought with your wife, or if you have had a fight with your colleagues in the department or whatever it is, then the pain, you can perceive the pain, intensity of pain can go up actually. Stress, chronic stress leads to chronic low back pain, it leads to migraines, it leads to hypertensive episodes, it leads to increased rates of alcoholism and drug abuse. So, these are all very much related, and social aspects also, the social factors, the cultural factors. If you have a support system, your family, if your family is not supportive, right, and if you are staying alone, and so these are so many factors which can affect the ultimate outcome of your pain response, right. So, pain is a subjective perception, understand, it is subjective, it is not objective. That is, you just can't look at a person and say that, oh, he is smiling, that means he does not have pain. No, it is not as simple as that. He might be smiling, he might be sitting quietly, but still he might be having pain, because pain is a subjective perception. So, it is my own perception. Your perception could be different, my perception would be different. And so, we use a scale called the visual analog scale to quantify the pain. How much pain? From 0 to 10. 0 is no pain and 10 is the worst possible pain. So, we tell the patients how much is your pain. So, from a scale of 0 to 10, and if they say 5, 6, 7, whatever it is, that means they have pain. So, accordingly we classify pain as mild, moderate and severe. 0 to 3 mild, 4 to 7 moderate, and 8 to 10 is severe pain. So, that is, so this is the visual analog scale to quantify pain, because pain is a subjective perception. It is filtered through individuals' genetic composition, learning history, psychological status and socio-cultural influences, as I told you, right. Now, this is another gentleman, he was a rickshaw puller, and then he had a tumor in his hand, for which he went to a surgeon, and the surgeon decided that he would cut off his hand. So, he was amputated, as you can see in this picture, his hand has been cut off here. The amputation was done. So, the moment the amputation was done, this man, because he was a rickshaw puller, he no longer could drive his rickshaw. So, immediately he went into unemployment, he could not afford anything. So, he had a family to support also, and in spite of the amputation he still had pain, because if you see here, these are the metastases, that is, the cancer had already spread to the axillary lymph nodes, and these lymph nodes were causing an entrapment, they were squeezing the nerves. Here we have certain nerves which is called the brachial plexus. So, the nerves were being entrapped and being squeezed by the tumor, and that was causing severe pain. And if you look at his face now, just look at his expression, an expression of resignation, an expression of hopelessness, because now he has lost his money, because all his money has gone to the surgeon, and in spite of the treatment he has lost his hand. So, losing a part of your body is a loss of an identity. Then he lost his job, and he still has the pain. He still had the physical pain and a special type of pain which is called neuropathic pain, because neuropathic pain is a special type of pain which is caused or intensified by pressure or a damage of the nerves. So, if you see his expression now, so he is almost in a state of total pain, because psychological, social, physical and spiritual also. Because when you come in such circumstances, then you start blaming God, or you start asking questions about your own existence. Why am I alive? What is the meaning of being alive? It is best that I die, and so on and so forth. So, these are certain issues that you should be considering. And as George Eliot had said, it is seldom a medical man has true religious views, there is too much pride of the intellect. So, pride should have no role out here, because we, as I had showed you the previous slide in which the earth, I had given you that example. So, we need to understand that science is not the end of all the roads. There are so many other things which are not necessarily explained by science. So, we need to keep an open mind, we need to accept so many other things. Here is another case which I would give you. This elderly lady, she used to live in a remote village in the near the places where I practice, and you can see she had this huge tumors, very large tumors, and we treated her. She had severe physical pain. We treated her with good analgesics, and her pain was very well controlled. But then, in spite of control of the pain, she was still unhappy. She used to say that no, I still have problems with my sleep, and so on and so forth. A state of hopelessness used to be in her. Then on repeated questionings, we found out that she had made a small kitchen garden in which she used to grow vegetables, right, and monkeys would come in the afternoon to destroy to steal away those vegetables and destroy the crops. So, what she used to do, she used to sit in the charpoy and she used to drive away the monkeys in the afternoons, because she had so lovingly made the kitchen garden. Her main concern was that when I die, who is going to take care of the kitchen garden, because who is going to drive away the monkeys? Because for her, the kitchen garden was her spirituality. Anything which gives you a sense of meaning and purpose in life is your spirituality. So, that the kitchen garden was her spirituality, and so that was causing her a spiritual pain. So, this is a classic example of spiritual pain, right. So, then we talked to her daughter-in-law, and then her daughter-in-law promised her that don't worry, even after you die, we will ensure that the monkeys don't come and destroy the crops, and only after that reassurance she could finally die. And she used to love smoking her hookah, and this out here is the kitchen garden. You can see the kitchen garden out here. So, these all things contribute to a good quality of life. Our focus and the focus of good palliative care should be on preserving a good quality of life. So, again that lady, and this is the kitchen garden. You can see she is sitting on a charpoy, and this is what she used to do every afternoon, and we ensured that her spiritual pain was taken care of. And as Eric Cassel had said, when physicians deconstruct suffering to its physical dimensions while ignoring the psychological and spiritual pain, they not only fail to relieve suffering, but also compound it. So, the last example which I gave you was an example of spiritual pain. Bodies do not suffer, only persons do. So, treat the person, just do not treat the body. So, if you now come to just the physical aspect of the pain, the scientific so called aspect of the pain. So, pain could be nociceptive, it could be neuropathic. Nociceptive means the physical pain. Suppose I cut your hand, there is a cut, the pain which is transmitted by the nerves all along to the spinal cord and then to the brain. So, that is the physical aspect, that is a nociceptive pain, and that could be a visceral pain or a somatic pain. Somatic means which is on the surface of the body basically, and visceral means like you have liver pain or gallbladder pain or intestinal colics. So, those are the visceral pains. So, visceral pains are not very well localized, they are more of a diffuse in nature. And then there is a neuropathic pain. Neuropathic pain, as I told you, that pain which is which happens when a nerve is either damaged or compressed or squeezed. And then there is an inflammatory pain. Suppose you have a boil or an abscess. So, that causes inflammation, the surrounding areas become red and inflamed, lot of prostaglandins and other leukotrienes are released, and that causes an inflammation and that inflammatory pain. And then you have a special type of pain which is called central pain. Central pain is a very special type of pain which is seen in certain neurological conditions like after a stroke or the phantom limb pain, after somebody's leg or hand is amputated, they still feel that the leg or hand is still there. So, these are special types of pain called central pain. Now, pain is facilitated by certain neurotransmitters like substance P, glutamate, serotonin, nerve growth factor. So, these things they increase the sensory aspect, they increase the speed at which the impulses travel to the brain. But God has made us almost perfect. So, there are certain inhibitors of pain, certain inbuilt mechanisms by which the intensity of pain can be inhibited, which are the descending analgesic pathways, like you have the norepinephrine and the serotonin pathways and the opioids, and then you use GABA, cannabinoids, dopamine. Cannabinoids, ganja as you call it. Now, cannabinoids have been gaining quite a lot of interest in the recent past, because they have a multitude of effects which can help a patient suffering from cancer, for example, like cannabis helps to improve the appetite, it can help to promote sleep, it can help to decrease neuropathic pain, right. So, cannabinoids have a multi-potential effect, multi-dimensional effect. So, what are the goals of chronic pain management? Here we are talking of chronic pain, we are not talking of acute pain, right. Chronic pain, that is any pain which has been persisting for more than 3 months. So, the American Society of Anesthetists in the year 2010, they came out with certain goals and guidelines. The first was to optimize pain control, because a pain free state may not always be attainable. So, if you think that no, I will not have pain, so that is not always going to be possible. Second is to improve functional abilities, physical and psychological well-being, that is, you control the pain to such an extent that the patient can do their normal activities. So, before pain the patient could not get up from bed to go to the washroom. So, now you have control the pain to such an extent that the patient can easily get up from bed and go to the washroom. So, that is about it. So, that is a state which you need to attain. Improve the quality of life, that is very important. Like so many people are there who have chronic arthritis of the knee joint, of the hip joint, they can't walk. But if you can reduce their pain to such an extent that they can walk or do their activities of daily living, then it becomes a very desirable sort of state. So, that is one of the goals, to improve the quality of life as well as to minimize the adverse events or outcomes, because all drugs have some adverse effects, especially when you are using it for a long term. So, you need to be focused on that aspect also, as well as if you are focused on India, you have to focus on the economical aspects, on the financial load that the patient is, that you put on the patient. Now, this is the WHO step ladder, which the WHO had proposed almost 40-50 years back. So, there were basically 3 steps, step 1, step 2, step 3. Step 1, whenever you confront a patient with chronic pain, you start with step 1. The first step, you give a non-opioid analgesic like paracetamol or NSAIDs, like which are available over the counter, like Brufen or diclofenac sodium. This you can combine with adjuvants. Now, what are these adjuvants? Adjuvants are basically drugs which per se will not reduce pain. If you give them alone, they will not perhaps reduce pain, but if you give them with an analgesic, with drugs which can reduce pain, they will potentiate the effect of the analgesics. So, popular adjuvants are like steroids like dexamethasone, then you have tricyclic antidepressants like venlafaxine or amitriptyline. Then you have gabapentin or pregabalin sort of drugs, right. Then you have certain other anti-epileptics like phenytoin sodium or carbamazepine. So, there are so many drugs which can actually, which per se are not analgesics, but if you combine them with analgesics in certain situations, they will actually enhance the effect of the analgesic drugs. So, the first step, you start with a non-opioid analgesics like NSAIDs, paracetamol with or without adjuvants. you continue this for at least 2 to 3 days, right. And in after 2 to 3 days, if this patient still has no relief or less than 50% relief, then you can go to step 2. In step 2, what you do is that you continue the drugs of step 1 and then you add weak opioids or opioid congeners like codeine or tramadol for that matter, right. So, you do not discontinue step 1 drugs, you continue step 1 drugs and which you add step 2 drugs with or without adjuvants. And then again you watch the patient for another 3 days. If still there is no pain relief, then you can go to step 3, where you continue drugs on step 1 and step 2, and then you add the step 3 drugs. In step 3, you have strong opioids like morphine or fentanyl or methadone, right. So, with or without adjuvants. So, that is how you go to step 3, that is step 1 drugs plus step 2 drugs, and then you add on strong opioids like morphine or methadone or say fentanyl for that matter. And now we have a step 4, which is an additional step in which you have to take certain special advice to go in for nerve blocks. You can give nerve blocks or start infusion pumps or spinal cord stimulation or lobectomies, etcetera, etcetera. These are certain costly procedures and very specialized procedures. Sort of end my presentation with this basic knowledge of pain, chronic pain and its management, and I hope that you have found it interesting. Thank you.